thank you for opportunity, madam, and very important topic, that is communication and teamwork during referral. So you have given this topic importance. This itself shows that we are in the right direction, because we ourselves, like I am at the periphery, Meerut, Muzaffarnagar, Western UP, where we see lots of patients. We see that it actually matters, because most of the time women are not adhered to our treatment protocols. They are not proper compliant. Even health workers as well as our doctors, providers, they are not able to communicate properly, and proper informed consents are not there. Litigations are lots of there. So we are not able to achieve our objective. So when we talk about the referral system, so what is this? This is the system in which the patient is sent from the health center, having fewer amenities, to the health institution or treatment center which has more resources, facilities and amenities. Or you can say that when you send the patient of one infrastructure to a higher level infrastructure, or it is a two-way exchange of information and returning patient to those who referred them for follow-up care. So such type of reference systems, they are defined, and this is, it could be routine, it could be urgent, it could be emergency, and normally reference is done for opinion or advice or investigations, treatment or admission. Level of referral system we all know, which start from village level workers to sub-center levels, primary health centers, community health center, district hospital and state hospital. So what are the important steps in effective referral process? Pre-referral preparation, this is very important. You have to collect all patient data, stabilize the patient, communication with receiving team, that is also very important. Provide verbal report using certain SPAR, I will show you what is that, and involve the patient and family, and then transport and handover and follow up, confirm safe arrival and ongoing care. So preparation, the important thing is that patient and his family member, they should be explained about the condition of the patient and need for referring to the next unit. बहुत टाइम ऐसा होता है patient come, no doctor, we are satisfied with you, हम आप ही के साथ कराना चाहते हैं. So you have to explain why you have to refer. Once the doctor has written the orders for referring, the referring form is filled and signed by the referring doctor. Patient's valuable and other belonging has to handed over to relatives. No dues are cleared by the patient. All medical document, investigations, report, X-ray, ECG, they have to be kept ready to set along with the patient. A referral involves sending a patient for the ongoing management of a specific problem, with the expectation that patient will continue to see the original physician surgeon for the overall coordination of care. Referral of a patient to hospital, specialist and other institution is an essential part of healthcare. Referral and reply letters for letters communication between doctors. Breakdown in communication could lead to poor continuity of care, delayed diagnosis, polypharmacy and unnecessary testing. Here we all are sitting from different cities, and we know that someone has a small clinic, someone has a small hospital, some are in a tertiary center. Though we are equipped, we are trained, but patients should reach to us in time. That is very important. Patients are referred to specialists when investigation or therapeutic options are exhausted in primary care, or when opinion or advice is needed from them. So a referral letter also helps to avoid patient dissatisfaction and loss of confidence. So this is some referral form where you have to write down all details of the patient, and in the present diagnosis, what you have done, what is the things, and in the content of referral letter, demographic data, initial statement outlining reason for referral, history of the presenting problem, past history, psychological, medication, allergies, physical finding, investigation, they all should be written. Now why we have to communicate? So here I am giving topic that for the referral, communication as well as teamwork. So of course effective communication, we all are familiar with this. The communication is not simple transferring of words, but effective. It is essential for an efficient, high quality of referral process, because with the move to providing more patient care, there is now often little face-to-face contact between primary care and specialist physicians and surgeons. So as a result, written communication in the form of referral request and reply letter is the most common means by which doctor exchange information relevant to patient care. So effective communication, it includes positive outcome, improved information flow, more effective interventions, improved safety, enhanced employee morale, increased patient and family satisfaction, decreased length of stay, improved quality. This is very important, because even trainees and residents and all junior staff, sometimes they say says, madam, we have done the treatment properly, but patient is not behaving. This is not our job. Why I should do, why I should not do. So here I tell them ki no, this all is our part, that we have to satisfy the patient. We have to tell them properly that this is good for the patient. So good communication is also very important. So always message must be clear. Sender must deliver message clearly and concisely. Receiver must be able to hear and receive the message. Receiver must be able to understand the message. Interruption or distraction must be avoided. And what does the lack of communication causes? Of course, faulty and incomplete exchange of information. Professional ignore potential red flags and clinical discrepancies. Create situation where medical errors can occur. These errors have the potential to cause severe injury or unexpected patient death. So healthcare communication, it could give the non-verbal cues. They are important elements of the communication model, and identify the elements in the communication in this illustration. So 4 top causes for communication failure. Mainly, culture does not promote successful handoff. Lack of teamwork and respect. Ineffective communication method like verbal, recorded, bedside, written. An inadequate amount of time provided for success handoff, and competing priorities, and unable to focus on transport patient. Solution: make successful hands-off an organization priority and performance expectation. Teach staff on what constitutes a successful hands-off. Standardize training on how to conduct a hands-off. Education and coaching. Engage staff, real-time performance, feedback, just-in-time training. Nurse uses standardized form, tools and method every time when handoff occurs. Focus on the system, not just the people. So this is the poor communication skills when baby is delivered by cesarean section, baby cared for in the nursery. So correct thing is that mother is transported to the ICU as she was in distress. Husband not aware of the visiting hours being different from the maternity. ICU nurse didn't communicate this, but instead called the security. So this is poor communication skills. So effective communication, I have already told you, and as time is not much, so there is a one thing that is called SBAR. So SBAR, S means situation, what is happening, that patient should be properly informed. B, background, what is the clinical background, to give the patient reason for admission, explain significantly medical history, and then inform the consultant of the patient's background. Assessment, vital signs, contractions pattern, clinical impression, concern, everything should be informed. And recommendation, that you have to tell that what it is done, you have to done, explain what you need, make suggestions, clarify expectations, finally what is your recommendation. Then comes to teamwork. Teamwork divides the task and multiplies the success. So we all know that teamwork in healthcare is very, very important, and different type of teamworks. We all know that core team could be there, coordinating team, contingency teams, ancillary services, support services and administration. So always all teamworks, they should possess specific knowledge, skills and attitudes, and the importance of effective team is increasing due to factors like increased incidence of complexity and specialization of care, increasing comorbidities, increasing incidence of chronic disease, global workforce shortages, and initiative for safe working hours. So role of a nurse and referral services, this is also very important, that we have to inform the referring unit telephony before shifting about the condition of the cases, treatment, so that bed is readily available with all the emergency equipment at bedside, and a specialist is available to see the cases. Nurse should explain the patient and family. Yeah, it is last slide. For the reason for referring to secondary and tertiary care, nurse should check the condition of the patient, whether she is fit to be shifted immediately or some emergency treatment is required, and then collect all documents, check the referral form, patient belonging, all the nursing personnel. So this was last slide, that patient safety goals. Goal 1 is identify patient correctly, improve effective communications, improve the safety of high alert medications, ensure correct site, correct procedure, correct patient surgery, reduce the risk of healthcare associated infections, and reduce the risk of patient harm resulting from falling. So that was in the last, that we proper communication at the referral time, and in all ways it is very important, especially in public system healthcare. The healthcare services should be provided at primary level, at the tertiary level, and this patient should be given optimal treatment and timely referral. That is very important for giving optimal care. Thank you.